elevated PSA, and when is it important for us to do something? These are my disclosures. I'm on the main insurance panel for all the personal insurance stated here in Singapore. Today, I'm going to talk about how to use and the actual misuse of PSA. How do we manage patients who have elevated PSA? If patient get prostate cancer, what do we do? And when should we ask a patient to see a urologist? The most important thing for us to know about PSA is a blood test, and it is prostate specific. PSA stands for prostate specific. Remember, this is not cancer specific. That's because whenever PSA is high, it can be because of many different prostate problems. Enlarged prostate, benign infections, cancer, recent ejaculations, even urethral procedures, and anybody with acute urinary retention. Some of these can cause the PSA to go up. What is interesting is that when the PSA is high, every patient will be worried about prostate cancer. There are many biomarkers for prostate cancer detection. And after they are detected, there are also many biomarkers to decide whether the cancer is dangerous or not. So if you look at the diagram, on the right-hand side, there are already many blood tests other than PSA that can predict which are patients with likely possible cancer. And if you look on the left-hand side of this graph, when patients have new prostate cancer, all these different biomarkers will decide whether they have a dangerous cancer or not dangerous cancer. These are already available in the market to be used. When you look at the summary of all the different types of prostate biomarkers, and you look at the graph, the top left-hand corner for A is everything you can do in a blood test to detect patients with cancer. On the right-hand side is everything in the urine sample they can detect as well. So you don't need to do a blood test, just check a urine. Bottom left, C, is actually tissue diagnosis. Whenever we take a tissue for prostate biopsy, we send them for biomarker tests. And D are some of the different other tests, including circulating tumor DNA and RNA. So looking at all this, what is important for us is that PSA is only one of the many biomarkers to predict whether someone has cancer. If you look at all the different available tests, in fact, not every test is approved. Only some tests has been approved by FDA. And looking at the list of the blood tests in Singapore, we only have total PSA, which is FDA approved, and prostate health index. And PHI is what we commonly use as well to predict whether someone has prostate cancer. There are many other urine markers or tissue markers. They are available, but they are not easily done in Singapore. We have to send the test overseas, and they can cost thousands of dollars. What is important for prostate health index? It is that in about 15 years ago, 10 to 15 years ago, it started to be more popular because many patients have elevated PSA. Then we are thinking, is it good or not good, or is it dangerous or not? So the key importance of prostate health index is that it's actually a formula. It's a mathematical formula. It combines total PSA, free PSA, and a pro-PSA fragment. They calculate a mathematical formula and decide whether patient is likely to have prostate cancer or not likely to have prostate cancer. That's the use of it. Important thing to know when we use a PHI is that total PSA must be less than 10. If it's more than 10, it's actually not useful because it is only tested in patients with less than 10 PSA. So how do we use it in the clinical practice? Every patient who first come in, we decide whether patient has a possible risk. We do a total PSA. Only if the total PSA is less than 10, then do the PHI. Please do not do the PHI before you know the total PSA. So the PHI helps us decide whether patients should be continued to be monitored or we should do a prostate biopsy, because if the risk of prostate cancer is more likely, we would prefer a patient to do for a biopsy to see whether they really have cancer. This has been in Singapore for many years, so I'm sure many of you would have used it. What's interesting in Singapore, we know the latest published guideline and the data from Singapore Cancer Registry is prostate cancer is now the #1 cancer in men, and it has become more prevalent compared to colorectal cancer and lung cancer. So many men are worried, are they going to have prostate cancer, especially when their PSA is elevated? We do know in Singapore, more Chinese are likely to get, proportion-wise, compared to Malay or Indians, to get higher incidence rate of prostate cancer. We do not know why. Is it genetic or food? We are not sure, but this is what we see over the last 50 years in Singapore. And what is more worrying is that many patients actually come in to see us in the clinic only when they get stage 4 cancer. Looking at the monograph of Singapore Cancer Registry in 2017, 30% of patients already have stage 4. That's because prostate cancer in the early stage has no symptoms. So many of them come in with back pain or urinary symptoms or gross hematuria. Actually, they already have stage 4. That's too late. So we are hoping more patients will be found in the earlier stage. And if they do a total PSA, you can help to change the course of direction of the prostate cancer. But what is worrying as well around the world is that global trends of cancer, many young adults less than 50 years old start to get cancer, especially for nasopharyngeal carcinoma and prostate cancer. These two cancers are found a lot faster in the earlier working adults, less than 50 years old. So when patients are less than 50 years old and they have risk factor, please check their total PSA as well, because they may have early stage prostate cancer, even though they are young adults. Well, we all know that most patients do not have urine symptoms when they have prostate cancer. Those who have symptoms may simply be having difficulty urination, blood in urine, wake up at night to pee, urine frequency, back pain, or the other problems when they get already stage 4 metastatic cancer. So this is something we know, and most patients with prostate cancer do not have symptoms. So when a patient comes to you and have elevated PSA in your GP clinic, what do? This is my suggestion. This is not the only way, but this is what I suggest we do. Number one, rule out male urinary tract infection. So treat it. Any STDs or even prostatitis can also cause patients to have elevated PSA. If the patient, a male patient, have UTI, a urologist referral is usually recommended, because sometimes they have urethra stricture, they may have urinary stones or other issues in the male urinary system. The second thing to check is, does the patient have BPH or prostate cancer? One of the ways is to check the size of the prostate. We see in the clinic, when the prostate size is normal and the PSA is higher, it is more dangerous. But if the BPH, if the prostate is very big and the PSA is slightly elevated, most likely it's benign, so not so worried. So size of the prostate also matters. The third thing I suggest doing is check only the total PSA. Don't do the PHI yet. You look at the total PSA. If it's less than 10 but elevated, do a PHI. If the total PSA is more than 10, do not do PHI, because it doesn't really help, because PHI has been used for patients with total PSA less than 10. Anytime total PSA is more than 10, you should refer the patient to a urologist, because they have 1/3 chance, about 30% chance of having cancer already in their prostate. When a patient comes to me, what do I do? How does a urologist determine who may get cancer or who may not? Number one, we look at family history. People who have fathers or uncles in the paternal side who has prostate cancer has a higher chance they get a gene transfer with prostate cancer risk. Second thing to know is whether the mother or the mother's relative, aunties, have breast cancer. We also know that breast cancer genes like BRCA1 and 2 can also be transferred to the male, and the man will have prostate cancer in the future, even though it's mother's breast cancer gene, but in the man, it will become prostate cancer when they have a BRCA gene in the family. Second thing we want to know is do a serum biomarker, total PSA, and sometimes when PSA is less than 10, we do a prostate health index as well. Third, we will do a MRI prostate scan in the hospital. Usually, we want to see the structure of the prostate and also any suspicious area in the prostate that may be cancerous or it could also be a prostatitis. So MRI prostate scan helps us determine what to do next. Of course, if we suspect a patient may have prostate cancer, we'll tell them we should do a prostate biopsy to look at the cells to look for cancer. Why is MRI prostate important? That's because MRI prostate first delineate the size and the place and the structure of the prostate. And the other thing is, nowadays we do MRI ultrasound fusion guided biopsy. When I was a trainee, when I was a young medical officer, our prostate biopsy was only ultrasound and a bit blind because we don't know where we are going for. It's a random biopsy. But now, when we have an MRI scan, we fuse the MRI image with ultrasound together during the biopsy. So it's fused together and it's like a GPS guided biopsy. We know exactly which place, the three-dimensional place where we put the needle in. So all our urologists in Singapore now has adopted MRI ultrasound fusion biopsy to get accurate biopsy, to know exactly where to biopsy, and you know which areas are suspicious or not suspicious. The other thing we do is when we are doing a biopsy, we always target the area that's suspicious. They call it the Pyrex 4 or 5 lesion. We also sometimes take other places outside the Pyrex lesion to also biopsy. So we have a map of the entire prostate to know which areas have cancer and which area do not have. This is what it looks like. Everyone who has to go through MRI scan, on top left-hand corner, we find the image of the MRI, and bottom pictures show you that during the actual biopsy, we fuse the image of MRI together with our transrectal ultrasound to get a 3D direction of GPS-guided biopsy. So what happens if patient have elevated PSA and found to have prostate cancer? It depends on whether they have early stage or late stage. And there are many different options, including focal therapy. Early stage cancer, if it's found, one of the things we can do is do nothing. We actually do active surveillance. Surgery and radiotherapy are the other treatment options. Of course, nowadays, early stage cancer, any cancer that's localized within the prostate, we can also do focal therapy where we treat the cancer within the prostate itself. Let me go through a short, brief introduction of each one. First, for active surveillance for early stage cancer, we also continue to do total PSA. So patients who have early stage cancer like Gleason 3+3, grade group 1, a very early stage, we may not do anything, but we simply check their total PSA. So that's why total PSA has been used as a tumor marker as well for monitoring. We sometimes repeat biopsy and repeat MRI prostate scan to make sure the cancer doesn't become dangerous. And this is useful for patients who have localized low-risk cancer and do not want to have side effect of the treatment for surgery or radiotherapy. So how about surgery? So this was me long ago, many years ago, 2008, when I was in New York City. On the left-hand side, I was operating with my boss. We usually do about 3 surgeries in one day. And also we were doing a Da Vinci robot about 2 a day. So depends on what patient prefer. So, but nowadays, majority of the urologists in Singapore are doing Da Vinci robotic because it gives a better high definition TV and more precise, and the wounds are smaller and patient recover much faster. So all our urologist friends will be doing Da Vinci robotic prostate surgery. How about for radiotherapy? It is usually used for patients with localized or locally advanced cancer and also local recurrence if a surgery didn't work. What about focal therapy? This is new. Not everybody is suitable for focal therapy. Imagine a prostate cancer that's found inside the prostate. It may be a small lump inside. Why do you have to remove the entire prostate or shine radiotherapy on the entire prostate? Because we know the side effect of radical robotic surgery is urine incontinence and patient need to wear diapers, or they also may have erectile dysfunction. And when you ask in a room, does any man want to leak urine and wear diapers? Nobody will raise their hand. When you ask, does any man want to have impotence and no more erection? Nobody will raise their hand. So That's why focal therapy has started to become more popular, where we only treat the cancer within the prostate. So for example, in diagram A, there's one spot, B, there's two spots. You can just focus on the prostate itself. And a lot of times in Singapore, for my patients, they now go home on the same day as a day surgery procedure for prostate cancer focal therapy. So there are a couple of more established focal therapy options. There are many, many of them, but these three has been more established. HIFU, cryotherapy, and nanoknife. HIFU simply focuses multiple ultrasound beams. It's just like when you have a magnifying glass and you have the sunlight beam shining onto a leaf, actually it can burn. So the ultrasound focus onto the spot of the cancer can heat up to 85 degrees Celsius and kill off the cancer cells. How about for cryotherapy? We use a special needle, 17 gauge, and we put argon gas exchange with helium, and the temperature of the cryotherapy probe reaches minus 40 degrees Celsius. When it's put into the patient, we have a freezing and warming cycle. So the cells will actually have a lysis and the cancer cells will die off. The third modality that's available in Singapore is called nanoknife. We use the principle of irreversible electroporation. We put the electricity to the place of the cancer cells area, and then once it happens, we put a direct current generator. So what happens is that the cell membrane will become porous, and then by osmosis, and the cell will rupture off, and the cancer cells will die. So these are the principles of focal therapy that we are using in Singapore. So the patients that is chosen for it usually are low risk and intermediate risk cancer, or sometimes when patients have radiotherapy and cancer come back again, we can do the focal therapy to save and salvage them, even in patients who have recurrent cancer after radiotherapy. So this is one of my last slides. So for elevated PSA, you know that some patients may be cancer, some are not. So when should you refer to urologist? So I have a one page summary, my suggestion of how you may want to manage your patient with elevated PSA. So when to see a urologist? You know, in front of you, the guy may be a calm guy who say, "Oh, I'm okay, everything okay, no problem, doctor." So just refer to urologists only if they're male UTI to make sure they do not have urethra stricture or urinary stones. Or second group of patient you want to choose is those with those who have a PSA less than 10 but abnormal prostate health index, because I'm sure all of you can order prostate health index from your clinic. A third group of patient is if their PSA is more than 10, don't even do PHI. Just refer straight away, because in Singapore and the worldwide data, 1 out of 3 of patients with PSA more than 10 will have prostate cancer. So we want to make sure we rule it out. Okay, how about the other group of patients who's a bit concerned? They ask some questions, a little bit concerned. If they have family history of prostate cancer in the father side or family history of breast cancer in the mother side, please refer them, because for all you know, they may have a genetic predisposition to having prostate cancer. And also, if their PSA still continue to be high when you repeat it a few times, over the few months, how come still high? Better refer to urologist. How about the third group of patient, the kanchiong worried patient who sit in front of you, who are more than 50 years old? Their PSA is rising, going up, and they are worried. Yes, then this group of patients, maybe you want to refer to urologists so that we can help to monitor or manage them. And of course, you have patients who keep checking Google, ChatGPT, or DeepSeek all the time, then give a stack of things and ask you about this. This group of patients, urologists can handle, no problem, because they will ask us a lot of studies, research from different places and say, how come this Google doctor say this, you don't say that? So these patients, you may want to refer to urologists. And the last group is those who cannot sleep, cannot eat after they get a abnormal PSA result, elevated PSA, cannot sleep, cannot eat. Then to reassure them, maybe you can refer to your friendly urologist. So this is my summary of my suggestion. Maybe you can just change and modify for your use in the clinic. When patients come to me in front of me First thing I tell them about their prostate cancer risk and their PSA, and I tend to reassure them that majority of people with a PSA less than 10 do not have cancer. So I also will, of course, manage their expectation and find out to make sure they have no cancer. I also tell them another thing. Please, do you want to be happier? I always tell them, no. So what is interesting is that many patients are worried and concerned. So I ask them, do you want to be happy? What is important that we have seen, there was a Harvard Medical School study that started in 1938. And this is the world longest study on happiness. You can't find anywhere else in the world to do such a long clinical research. After 75 years of research study, they look at the longest medical study of human life. What did they find? What causes happiness? This is what they find. Good relationships lead to health and happiness. When patients tell me, they'll ask me, do you give me medicine? I say, no. Tell me what to do. Oh, just have a good time. They don't believe me. But this is what Harvard Medical School says. And if you're okay, I will show you the video. This is Professor Wardinger, the fourth director of Harvard Medical School that run this study. If you can allow me to share with you. After the advertisement is from YouTube. Got it covered.
Guaranteed best price. Confirmed night.
Eddie, can you hear the video?
The video is starting.
What keeps us healthy
Yeah,
and
I
happy
can.
as we go through life? If you were going to invest now in your future best self, where would you put your time and your energy? There was a recent survey of millennials asking them what their most important life goals were. And over 80% said that a major life goal for them was to get rich. And another 50% of those same young adults said that another major life goal is to become famous. And we're constantly told to lean into work, to push harder and achieve more. We're given the impression that these are the things that we need to go after in order to have a good life. Pictures of entire lives, of the choices that people make and how those choices work out for them, those pictures are almost impossible to get. Most of what we know about human life, we know from asking people to remember the past. And as we know, hindsight is anything but 20/20. We forget vast amounts of what happens to us in life, and sometimes memory is downright creative. But what if we could watch entire lives as they unfold through time? What if we could study people from the time that they were teenagers all the way into old age and see what really keeps people happy and healthy? We did that.
So let me show you the summary of what they found.
The longest study of adult time. So what have we learned? What are the lessons that come from the tens of thousands of pages of information that we've generated on these lives? Well, the lessons aren't about wealth or fame or working harder and harder. The clearest message that we get from this 75-year study is this: good relationships keep us happier and healthier, period. We've learned three big lessons about relationships. The first is that social connections are really good for us, and that loneliness kills. It turns out that people who are more socially connected to family, to friends, to community are happier, they're physically healthier, and they live longer than people who are less well connected. And the experience of loneliness turns out to be toxic. People who are more isolated than they want to be from others find that they are less happy their health declines earlier in midlife, their brain functioning declines sooner, and they live shorter lives than people who are not lonely. And the sad fact is that at any given time, more than 1 in 5 Americans will report that they're lonely. And we know that you can be lonely in a crowd and you can be lonely in a marriage. So the second big lesson that we learned is that it's not just the number of friends you have, and it's not whether or not you're in a committed relationship, but it's the quality.
You wait for those few seconds
of your close relationships.
So I will change, because of shortness of time, I will change. And if you're interested, you can watch this video. Relationships are important. And I tell my patients, yes, you have elevated PSA. Now that it's not cancer, it's just BPH or prostatitis or other things. Please remember to smile. Self-care, look after yourself, make friends, inner peace, have joy, and also love others and exercise. And these men, whatever PSA they have, and when they have no cancer, they actually walk out happy. They may have better relationship. So as a doctor, we all play a part to look after people's well-being as well. I've learned this from many of my patients who have prostate cancer, because I help to manage prostate cancer support groups. That's why from the experience and learning from them, some of us started the drhughes.com program, and we actually have this wellness program run by doctors in Chiang Mai. The aim is to reduce stress and reduce burnout. So see whether it helps your patients who are very stressed and concerned. So this is one of the possible places they can go. The other thing we found is that many people come in with stacks of Google Notes, ChatGPT, and say that this is what their friends say. So which is why during COVID, some of us started this asiamd.com website to give them accurate healthcare information. And many of the medical articles are written by doctors. A similar one you may know is a WebMD in US. So we are the Asia version called asiamd.com. So we are on all these social media. And of course, AsiaMD also hosts this CME talk. We're also holding a public talks for publics as well, and watch out for it in the coming months. Some of the articles, some people want to find out, is ChatGPT good? These are some of the articles that you can find on asiamd.com, and patients can translate it to Mandarin and to show it to their friends, and to know whether AI chatbot can be used, how to look for fake news in Google or ChatGPT's, DeepSeek, how to use correctly. Thank you and God bless, and thank you for your time.